Hello everyone, my name is Charles Hammer. I'm a registered nurse in an emergency department of a level 1 trauma center. I'm the clinical staff leader of the department, and I recently became sick with the flu. So I'd like to talk to you all about a couple of things I was asked by my family and friends and some of the things that I tell people that come into the ER. One of the big things is, for me, the reason I went to the ER is because I became very sick as far as dehydration goes. I was unable to hold any fluids down. I was vomiting, I was throwing up, I felt very weak when I stood up, and I almost passed out. So I knew it was time to go to the ER. And that's kind of what we tell people. We tell them there's really two reasons you should go to the emergency department. That's going to be shortness of breath, like if you're having trouble breathing and you can't catch your breath, or if you become very dehydrated from severe vomiting. If you do get the flu when you're at home, you're going to experience a couple different things. You're going to have body aches, you're going to have nausea, you're going to throw up, you're going to have diarrhea, you're going to have a fever. All those things are okay. You can treat those at home. It's treating the symptoms is the big thing about the flu, because there's really no prevention of the flu besides getting the vaccine. We tell everyone to get the flu shot. Unfortunately, according to the CDC, the effective rate of the flu shot has went down. So even though that is the case, we still recommend everyone to get the flu shot. Waghorn stated that the mortality rate of the flu has went up recently, so I believe that's a big reason why a lot of people go to the ER now. Even though we still tell people to get the flu shot and stay home, you know, the flu shot can help you fight the virus better, and it's going to keep you from getting the flu. If you do get it, like I said, stay at home. If you have to go out, we tell people to wear a mask. Also, while you're at home and you're around your family and your friends, please wash your hands. That's a big thing that we tell people to prevent the spread of the flu. It's spread by droplets, so we tell people to kind of always wash their hands and, you know, wear their mask if they have to go out. We tell people to stay at home. I did not go out when I had the flu. I tried to stay at home. The only reason that I went out was to go to the ER. When I went to the emergency department, I told them up front, I said, I know that I have the flu. I feel like I have the flu. I know that I really don't have to come in, except for the fact that I've been throwing up for 3 days and I passed out when I stood up. So that's the reason that I went. A study from 2017 states that everyone should get the flu shot. That's the most preventative factor in not getting the flu is the flu vaccination. It not only helps you to not get the flu, but it weakens the symptoms of the flu if you were to get the flu. So with all that being said, some of the main reasons to go to the ER, like I said, is if you are very short of breath or if you become severely dehydrated from throwing up. Get the flu vaccine. We recommend that everybody get the flu vaccine because that helps to keep everyone from spreading it. Overall, my experience with the flu was horrible. I did not feel good. I felt very bad. I was sick for a long time, and it took me a while to recover from it. So if I have one thing to tell anybody is get the flu shot, don't get the flu. Thank you for your time. I'm Charles Hammer.